I'm 22 years old currently, and I'm working as a social media strategist with media agencies and brands. I also create content, and I am also an influencer. I create content about wellness, holistic healing, and providing support for psoriasis warriors and sustainability at the same time. So that's what I'm doing professionally at the moment. Talking about my skin condition, then I've had psoriasis for the past, I think, over 14 years. So since I'm only 22-year old and I've had it for 14 years, I've lived with it like for basically my entire life, my existence. So like I can't imagine myself without being a psoriasis warrior. So that's what I'm doing right now. Then in terms of my journey, I think if we focus on the treatment side of it or how I've handled it, I've tried out basically anything that exists, like from Ayurvedic to, allopathy and homeopathy, and then, all sorts of like treatments. And it's been like a roller coaster because, like it comes up, then it goes off, and you never really know, what's gonna, fix it technically, but there's no cure actually. So yeah, that's about it about my journey. When I was 8 year old, like this is how I was diagnosed. When I was 8 years old, I got a little hurt on my toe, like on my feet, and then like it bled a little, and there was like a injury. And when the skin was recovering, I felt it was like different. My normal skin wasn't coming back, and initially, like I was unsure. I showed it to my parents because I was a child then, and they were also not sure like what it is. They just thought it'll go away in some time. And then obviously the first point of contact, when it was like a month or something, when it did not heal completely, we went to the doctors. We talked to our family doctors who could like suggest us on what to do, where to go, and stuff like that. So yeah, that was about it. Like initially we were like just clueless because we had never heard of something like this or seen something like this, so it was confusing. The first was a dermatologist, of course. And when I went to his clinic, I found out that it's psoriasis. And then he sort of explained it about how the skin renewal cycle gets disturbed, and the dead skin cells start forming layers, and like the basic fundamentals of psoriasis as a disease. That's what he told us. And then he prescribed me a few creams and some medicines for itching and stuff like that. So I followed that for quite a long time, and then initially like I was told that it'll go away, and even though there's not a cure, it's easily managed. But then like I was unsure about it after a point of time because nothing seemed to work for a long time. And it's funny because, like the disease is like this, it comes and goes. Stigma wise, it's, like there's no doubt, that there's no stigma because I've been asked a lot of weird questions, around the way my skin appears and things like that. Because like randomly, like you don't know someone, and on the road, on the streets, you're at the mall or somewhere, and they'll come up to you and and ask questions, so it feels weird because especially that like I was a child, I didn't expect someone to come up to me and then ask me things like these. So it was weird. And then the kind of things that were asked to me was even more strange, stuff like, what is this? And there was always a question about it being contagious, especially with people who I was like around all the time. And then someone thought it was a chicken pox or something, so things like that. And then as and when I used to get asked these questions, my psyche, was transformed in a way where I perceived everyone to be a threat, and they don't, like want me to be around them because of my skin condition. And I was like, it was like, very damaging to, my mental health. And it can be to anyone, because you start to perceive yourself, there's like a concept of self-hatred, because you start to think that no one likes you, so you end up not liking yourself or not loving yourself for what you deserve to be. So yeah, that sort of things came across through my journey. One part, like, again, about this the stigma thing, the thing was that since no one, like, you don't feel like you are being approved of, like, being in a society, you feel like you should be validated and you should be approved as a person you are, right? And then when people start to ask you questions like these, you start to feel like you're not a part of it, or you're something unusual and strange and different. So it's sort of starts to feel like you are an outcast, and then there's like a different section of the society who are like normal. My journey, the most important angle is that I was a young child when I was diagnosed with psoriasis. So that sort of age, like, you're not really sure about what you're doing or what you're supposed to do. So my knowledge was limited by what my parents understood to be right or wrong, and what should be done. Like, it was just like my parents would decide it for me, and then I have to do it, like, no matter if it has side effects, or like, it's limited to that. And then again, like, for a child, at the age of 8 till like 15, those are like your transformation years, where your mindset builds up, your psyche builds up. So obviously, because of all these stigmas that I talked about, and then the mental health aspect of it, there's definitely going to be an element of anxiety and stress, and then depression. So, and we know that psoriasis is triggered by stress, so it's like a vicious cycle. So it doesn't really help, like, it's like a culmination of all things making it worse. So that was one thing. And then about difficulties, then sometimes medications were not available, like, especially when you're living in a metro city, I guess you have better access to new trends or new treatments and things like that. But I used to live in a tier 2 city earlier. Like, now I'm in Bangalore, but I was born in Raipur, so it's a tier 2 city. And then a lot of the medications were not available. Like, my doctor used to tell me that this medicine you can use and it has a good result, but it's only available in abroad, you won't find it easily. So my relatives who used to live in abroad used to get it for me in bulk. Then again, like, the pricing of these medications was so high, so it was difficult. And these are the sort of problems I faced. As far as I know, I don't think it was covered under a health insurance plans, because I don't think I had a health insurance plan, because I mean, if my family would have one, that would probably be for my parents and not me. So to my knowledge, I don't think there was anything related to this. Like, everything was paid out of my parents' pocket. Suggested with biologics. I was also suggested with, I don't exactly remember how to say it or pronounce it, methoxtrate, something like that. So, I mean, with regards to being suggested new medications, I would have been open to it if I was starting off with the diagnosis and stuff like that. But after a period of time, when I realized that like, there is actually no cure, and we're just like trying out different chemicals and drugs to see what could help me manage my condition. So after, like, especially when I was suggested with biologics, for some reason I didn't feel like going with it. Like, my gut told me not to go with it. And then when I started researching on it, I found out all about the side effects, it has. And then again, with methoxtrate, all the side effects it has on, like, liver and stuff like that. And then again, since I had been taking the steroid creams, so I found out the side effects for those as well. Like, when I got into the rabbit hole about of all the side effects these drugs have on me for using them over a long period of time. And you definitely have to use them over a long period of time, because there is no cure and you have to, like, keep using them. And the thing that makes me angry about this is that, I wasn't told by my practitioner about these side effects, or like even the slightest bit of information. So that's very disappointing. And I went to a new doctor when I moved to Bangalore, because obviously I had to see someone who I could like reach out to very easily. So I went to this doctor, and he told me that there's this new medication that has, come across his attention, and he wanted to try it out. And like, even though when you release a drug to the market, there are like clinical trials and things like that, but when I was told that it's a fairly new drug, and I had an experience of, I had the knowledge that, like these drugs cause side effects, I felt bad, because it was like feeling like a rablat to, try out new things on. So that's also one, aspect to what it makes the patient feel like, even though it's a new drug, but then I would like to see how, like, its results or something. And when I researched about this drug, there was not so many significant results that I could find. So I didn't want to try out something new unless I had full knowledge as to what it can do to my body. Try to explain this with an incident. Since, it had been around, I guess, 4 or 5 years that I had psoriasis, and it was just like coming and going. And I think around the time it was increasing also. Like earlier I used to have it only on my feet and hands, and then it was coming across my body, on my arms and my thighs, and other areas of my body. So we used to visit like a lot of doctors in metro cities, like in Delhi or some other city. So there was this one time where we visited this doctor, and he, after like just asking me these general questions about my health and my skin, he asked me, do you feel, like, he started to ask me about my emotions related to this condition. So that's when it hit me, like, I felt very content because he started asking me those things, because I realized that, like, no one has ever talked to me about this before, like, through words. Even though my parents would understand what I'm going through or something, but no one actually talked about it, what I might be feeling and things like that. So that felt like a revelation, like, towards, what I might be feeling, and understanding that I have to communicate about this. So I think it's definitely necessary for health practitioners to, counsel their patients about their mental health, and then, what goes around and how it's perceived and things like that. I'm sure like the patients know how it's perceived, but just talking about it makes them feel a lot better, like I did in my case. That I've tried all sorts of treatments and things like that. After a point, I realized, that I just accepted that I have this condition, and since there is no cure, I should just accept, how it is, and I'm going to live with it. So I feel like the moment you start to accept that you have this condition, it goes upwards from there, because you're not anxious anymore. Like, obviously you will get anxiety, but then you start to learn how to deal with it. And until unless you have this acceptance, I feel till then, you're constantly doubting yourself, you're constantly hating yourself for having it. And like, then your like your emotions go on a toss if you depend on validating yourself by the way your skin looks and things like that. And if you just accept things how they are, then it goes upwards. So the moment, like, when this happened, I guess over 2.5 years ago, like right before the pandemic, that I got this realization. And then since then, I've always tried to make a positive effort into learning and educating myself for the information, on how I could heal myself naturally and not through the treatments. Because when I realized about topical steroid withdrawal, that's when I gave up on all the creams and drugs and stuff like that, because I didn't want to subject my body to all these things. And that's my personal opinion on it. And then I started to learn about nutrition and how to, like, holistic healing, how can I heal myself naturally? So since then, I've like tried out different and different practices, like you know taking like a lot of self-care and having those routines to ground myself. And then since then I feel like I've done so much better in terms of like recovery. My skin does not look so inflamed anymore. Even if I get a flare up, it's like I have uneven skin, but it's not inflamed. And I feel like even though it has, like I've had flare ups even after then. Like I had the worst flare up in these past 14 years this summer. I'm not sure what was that about, but still I was able to recover from it by these, like things I've discovered on my personal holistic wellness. So yeah, I mean, since like I guess like since these past 2 years, I've learned to how to manage my psoriasis better, and that has really helped me. I think there's definitely a need for support groups, and I'm trying to build one as well. But otherwise, like building support groups is difficult because first of all, you don't find each other so easily, and then I feel what is more important than this is raising awareness about it. Because even though I can find a support group where I can talk about my feelings and like just feel supported, like that's obviously important, but other than that, like the main half of the main cause for all these emotions is the society. So if everyone like made an effort to know about this, or just like understand that you should not ask things related to like someone's personal problems, like if they are obese or if they are fat or if they're too skinny or anything that is visual. So if like everyone start, like if there was awareness like this, it would help even more. My advice would be, first thing, don't feel burdened. Don't treat yourself like a victim, because till the point you keep doing that, you're not gonna feel, like you're gonna feel powerless. And the moment, like I said earlier, the moment you accept yourself the way you are, you start to feel empowered, and you start to feel like you have, like the power in your hands to educate yourself, to get the experience of how you could help yourself, right? So I think that's the best way to start off a journey, upwards towards recovery. Because I felt, the more you stress out about these things, the more you victimize yourself, the the cards just fall down. Like the if mental health were cards, it'll just go falling down like a dominoes. So it's best, to accept yourself and then see where your fate takes you. Because I'm sure once you do that, like you start to manifest all things towards your recovery, and then you can definitely go into remission.